This is your week 5 canine muscles. So the first muscle we've got is the sartorius. So it originates from the tuberococci and the iliac crest and inserts onto the crural fascia and the cranial margin of the tibia. The cranial part of this muscle, because it's got two heads, so the cranial head flexes the hip and extends the stifle, and then the caudal head flexes the stifle and then does some form of adding the limb to the midline. It's innervated by the femoral and the saphenous nerves. So when we look at the lateral image of the pelvis here, you can see that the most cranial sort of front part of the pelvis is the iliac crest on the wing of the ilium, and then the more ventral part is the tuberococci, but runs obviously a little bit round the front as well. And then it's inserting down onto the cranial margin of the tibia. So you'd find where your tibial tuberosity is and then come slightly back a bit further than that, and that would be where your cranial margin of your tibia is. In the right hand image you can see the two heads. So the first head, which is the cranial head, you can see that is coming from that iliac crest and then down by an aponeurotic attachment onto the crural fascia and the cranial margin of the tibia. And then you can see the slightly more caudal head, which is originated from the tuberococci and is inserting again by aponeurotic attachment down onto the cranial margin of the tibia and the crural fascia. You can also see as well that with the caudal head it is slightly a bit more medially, and this is how it allows it to, under contraction, help with bringing the leg into the midline. So Lauren's going to palpate this. So first of all, you want to find where your tuberococci is and your iliac crest. So that cranial part of the pelvis, and then you're going to come down, and the crural fascia sort of runs medially and laterally, but then you're going to then find that cranial margin of tibia and just indicate that that is there. Then outline the muscle. So Lauren's just obviously showing you one of the heads here, and then going down the cranial aspect. And because she's showing you the two parts, the caudal head goes a little bit more medial. So she's just showing you both there. So you need to palpate it on the lateral aspect and on the medial side to get both of the heads. So that's your sartorius muscle. The next muscle is part of the gluteals, so we're going to go through the superficial, middle and deep. So the superficial comes from the gluteal fascia, so this will be like an aponeurotic attachment, the lateral part of the last sacral caudal vertebrae and the sacral tuberous ligaments, that was that ligament that I was talking about in the other image, and inserts onto the gluteal tuberosity. Its action is to extend the hip and retract the limbs, so that's a different function to equine, because in equine it flexes the hip, and we'll go through why this is the case. It extends the hip in the dog, and the innervation is the caudal gluteal nerve. So in the far left hand image you can see where your sacral tuberous ligament is, going there obliquely across the pelvis, and you can see that it's coming from the lateral part of the first sacral vertebrae, and then it's coming out and then inserting. So what it does is it comes off of the vertebrae and then wraps around the back and inserts caudally onto the femur. And the gluteal tuberosity, if you look where the greater trochanter is, you'll see that the gluteal tuberosity is a little bit further down, but it's very caudal. So that's a lateral image of the femur there. And you can see that it's a very caudal point on the actual femur. So that's why it's quite far back. And because the gluteal, superficial gluteal comes in and wraps round back onto this bony landmark point, that's why it can retract the hip when it's contracted, and that's why it extends the hip, because it's got this very caudal insertion. And then you can see here from the dorsal aspect, you can see where the superficial sits relative to the middle. So the middle is a little bit more cranial. Obviously your deep's going to be under both of these, and then you've got your superficial out the back. Oh, let's go through the palpation. So Meg's just going to outline here where the gluteal fascia is. So it's running over the pelvis. And then she's palpating back for the lateral part of the first sacrum. And then just showing here where the sacrotuberous ligament would be running down in the pelvis, and then palpating down to find the greater trochanter, and then coming caudal for the gluteal tuberosity. Outlining the muscle. And then palpating in fibre, and then cross fibre. So the next muscle we've got from the gluteals is the middle gluteal. So this one obviously sits a little bit more cranial in front of the superficial. So this comes from the gluteal fascia and the wing of the ilium, and inserts down onto the greater trochanter. And it helps to extend the hip, retract the limb, and abducts the limb, so it can do a little bit of external rotation, and is innervated by the cranial gluteal nerve. So with this muscle, what it's doing is coming off the actual wing of the pelvis. So I've highlighted that on the diagram, and that is obviously inserting more proximal onto the greater trochanter. So you can see in the image where the muscle is actually running, you can see that it's coming off the wing of the ilium and then inserting on the very proximal part of the greater trochanter on the femur. So obviously when this contracts, it pulls the femoral head forward, so then obviously we'll allow the hip to extend and the limb to retract backwards. So Meg's going to palpate this for us. So again, she's just finding where her gluteal fascia is. Then highlighting where the wing of the ilium is. And then coming down to find where the greater trochanter is, outlining the muscle. Then palpating in fibre, and then cross fibre. So the next muscle we've got is the gluteal muscle, so the deep gluteal. This is the deepest, obviously, of all the gluteal muscles. So it originates from the gluteal surface of the ilium. So if you look at the centre image with all the muscles there, you can see where the red dot is. You can see that the deep gluteal originates a lot further back on the actual ilial wing, and then it inserts more cranial and proximal on the actual greater trochanter, and a bit more medially than the other gluteal muscles, which is why it can help again with rotating the femur medially, but also can then help with a bit of abduction as well when other muscles work in support of this. And it's innervated by the cranial gluteal nerve. So we're going to get Meg to palpate this now. So you want to find and obviously identify where your wing of your ilium is. Then showing that you've obviously got your gluteal surface, and then that it's coming down onto your greater trochanter of your femur. So you're going to go in fibre and then cross fibre as Meg's doing here. And obviously you'll just be indicating that that's going to be a really, really deep muscle. And it's going to be one of the smaller gluteals in comparison to the others. So you can see this in this image how the superficial gluteal is coming off those lateral aspect of those sacral vertebrae and then wrapping round and down onto that caudal aspect of the femur, onto the gluteal tuberosity. You can see that your deep gluteal is running more obliquely and deeper, and then your middle gluteal, which is obviously the more cranial muscle in front, you can see that is obviously lying in front relative to the superficial that wraps around the back. And then you can see that from the dorsal image as well, that the middle gluteal is obviously more cranial and the superficial one is the one that comes out from round the back and wraps in down onto the femur. So the next muscle that we've got is the tensor fasciae lata. So this comes So the next muscle and the last one is the biceps femoris. So it originates from the ischiatic tuberosity and the sacrus tuberous ligament. So that's that ligament that I've highlighted to you before, but you can see it clearly on this diagram here. And then it inserts down onto the patellar ligament, the tibial tuberosity, the cranial part of the tibia, the crural fascia and the tuber calcaneus. And its action is to extend the hip, stifle and hock when weight bearing, and then flexes the stifle and abducts the limb in the non-weight bearing function. It's innervated by the sciatic and the caudal gluteal nerve. So you can see in the pelvic image that the ischiatic tuberosity is obviously the large bony prominence at the back of the pelvis. So that's those bony landmarks where we see at the back of their bottoms. It looks like, and the hair can swell over the top of them. So that's our ischiatic tuberosity. So the origin pings off of obviously this caudal part, but also the sacral tuberous ligament attachment, which you can see in the far right hand image. And then it fans down onto all these other areas. So it's coming down onto all these 5 insertion points. I've just given you 3 arrows there in the middle image, just because they should, obviously between the patellar ligament and the tibial tuberosity and the cranial part of the tibia and the crural fascia, they are all in those areas there. And then it's coming down onto the tuber calcaneus. So we're going to palpate this muscle. So obviously there's quite a lot to this muscle. So you've got to remember it's got 2 origin points and it's got 5 insertion points. So let's palpate this muscle. So Meg's identifying that's coming off the back of the ischiatic tuberosity and then indicating the sacral tuberous ligament. So it's coming down off that portion there, and then it's coming down onto the patellar ligament, the tibial tuberosity, the cranial part of the tibia there, then obviously the crural fascia, so that's all that fascial attachment down the front of the leg, and then down onto the tuber calcaneus. So you want to obviously outline the muscle. So it's a triangular muscle. It's obviously coming in and then obviously inserting onto the stifle and then going to a tendinous insertion down the back onto the tuber calcaneus. So Meg's just showing the caudal head of this at the minute, and then how it then starts to fan in to the stifle to the other attachment points. and then cross fibre. And obviously remember, we wouldn't go cross fibre down the tendinous portion because obviously you can't palpate muscle at that point. And that's the end of your week 5 muscles.